Hello everyone, I am Dr. Atluri Ravikant. I am interventional cardiologist at Yashoda Hospital, Somajiguda. Today we are here to speak about a few topics in heart diseases or heart ailments. So I want to make you aware of few things, few misconceptions which are happening in general public. So the first one of all I found is hypertension. So lot of people believe that hypertension, which is called high blood pressure, is manifested by some kind of issue like anger, behavioral abnormality, and giddiness, headache. This is actually misconception. Hypertension is absolutely asymptomatic or silent disease. So that's why we ask people to get their blood pressure checked once in a while, and especially who have family history of high blood pressure. And contrary to this, a lot of people think that if they are angry on someone, they are shouting on someone, or they have a headache, they have giddiness, only then they think it is a blood pressure. So it is not true. You can be as calm as a meditating person, as calm as a saint, and absolutely peaceful looking, but your blood pressure can be extremely high. So this is the reason you need to check your blood pressure once in a while. At the same time, I want to make you aware of some other thing, which is other end of the spectrum, that is over awareness. Some people keep checking their blood pressure every hour, every 5 minutes, every 1 hour, and make themselves uncomfortable and make their relatives and their partners uncomfortable. So that is also not right. Blood pressure is a chronic disease which is going to be there for years. So to diagnose blood pressure, you need to ask your doctor and consult your doctor, not by yourself. You should not interpret the readings and come to a conclusion. You should go to a doctor, and the doctor should be a good specialist and like a degree holder, who will be capable of understanding what is blood pressure and identifying it, diagnosing it, working up why it has happened in some people, and then prescribing drugs. So you have to leave the diagnosis to your doctor. Don't try to interpret by yourself, number one. Number two, you should understand that blood pressure is a tip of iceberg. It is what you see, the blood pressure. Once you diagnose, the disease has been there already for quite long. It takes probably 3 to 4 years for the pathology to happen and blood pressure to come out. So if somebody is diagnosed, please understand this, the blood pressure is not today. It is there for quite some time. So as a doctor, I would look at, if somebody comes to me worried about having a blood pressure, it is not their behavior, it is not their symptoms which are important. We look at their blood pressure value and understand whether this is a anxiety which shot it up, or is it there for quite long and it is a disease. So for that, if it is not severe, if it is a borderline, we give time of say 1 month, 2 months, 3 months, if there is no organ damage. So we check with a lot of, first is history. We ask a few things and then get into examination and then check their blood pressure. And after that, once we are convinced about having blood pressure, we would give time for say couple of weeks for having blood pressure checked once in a while, and then we make a chart of it, ask them for lifestyle modification, ask them to come back, and then we write blood pressure medication. So this is how blood pressure is dealt with.